So let's look at some of the data behind ctDNA and bladder cancer. So what we know is that ctDNA burden increases with stage. What that means is that it's going to be easier to detect ctDNA from a stage 4 patient than a stage 1 patient. This makes sense because a stage 4 patient has more cancer. At this point, we're not able to measure the ctDNA and say, you have this stage of cancer, however. We can also look at genetic changes in the ctDNA. And what it's been found, as shown in this graph on the bottom, is that the ctDNA in patient bladder cancer tissues is the same as measured in the blood, meaning that we are detecting the same genetic changes in the blood versus the tissue. Now, there's two types of ctDNA assays that we can use. One that reports out the genetic changes. For example, if your doctor does genetic sequencing, they can either look at the genetics of the tumor or they can look at the genetics in a blood draw. And we're fairly confident that the results should be about the same between the two. The other way it can be done is through a blood draw that measures what's called passenger mutations, meaning mutations that we don't necessarily know that are driving the tumor, but can detect that there's a tumor there. These can be interpreted in terms of a number, for example, in the Signatera assay, that can say you're positive for bladder cancer, or if it's 0, you're negative for bladder cancer. So in terms of ctDNA as a prognostic biomarker, in metastatic bladder cancer, it's been found to be prognostic, meaning patients with low levels of ctDNA have better overall survival than patients with high levels of ctDNA. This is one of the first prognostic biomarkers that we have for bladder cancer. We can also ask the question, does it predict response to treatment? And ctDNA can be used to follow along immunotherapy. Now, for those of you who are on immunotherapy, your doctor might have mentioned that sometimes it's tricky to follow the immunotherapy response on scans, because sometimes cancers will grow on the scan before they eventually shrink. But ctDNA can actually follow along immunotherapy and be another piece of evidence for whether you're responding to immunotherapy or whether you're not responding.